So I hope you all have enjoyed the first day of conference. So today, as we promised, that we'll be starting with something very new, some ultrasound simulator to learn the musculoskeletal ultrasound. And those who are present here, they'll be getting free access to this software for 3 months to learn the lumbar areas, basically. And I hope 3 months is enough to learn the lumbar area. So, though still there are certain fine-tunings are going on. Today, right now, those who are with your laptop can have the experience. We'll be giving you the login ID and password, which you can test on your laptop who are there, who are bringing the laptop. But actually, the real access with your actual email ID and password, which will be enabled from 1st of April. So, but today you can have a test run. You can, on your laptop, you can test how it is. But before that, because the topic is relearn lumbar spine with ultrasound. So I'll be quickly going through the little bit of anatomy. To learn the ultrasound, all of you know that learning anatomy is very, very important. So I'll be quickly going through the anatomy, and then there'll be a very quick test on Kahoot. You all have to answer this question through the Kahoot. Whatever is your mark, even if you are getting 0 mark, no issues. But through that, we'll be collecting your names. So those who are present here and those who wish to use this software free, they must be playing Kahoot with your real name. And we'll be sending you the login credentials before the 1st of April. Okay? So all of you have to log in through the Kahoot ID. But first, so what I'll be doing, right now I'll be going through the 3D anatomy software. After that, based on 3D anatomy softwares, I'll be having some multiple choice question, which you have to participate through Kahoot. I hope all of you are accustomed with Kahoot. So those who are not, just open your browser. Not right now, when I'll be telling. Open your browser. In the browser, you put kahoot.it, kahoot.it, and then it will be asking for your game pin. The game pin will be shown there, and then you have to put the nickname. Don't put your nickname, you put your real name, so that we know who are you, and we will be sending you the login credentials in that email ID, because all of your email IDs and the WhatsApp number are with us. We need to know who are present here. Only they will be getting this login credentials free. And after that, I'll be showing you the features of this software. And the most important person who has developed with his team is the Nandini Vanjara. He'll be showing you some of the features which are still going on. And by April, the full form will be visible. Right now, most of the basic features has been upgraded. So you'll be able to experience that right now if you are having the laptop. With the mobile, you cannot experience it because you must be having a laptop. Because your mouse will be converted into a ultrasound probe. Your screen will be having one side will be like ultrasound screen. So where you can increase the gain, decrease the gain, you can change the orientation, you can make a short axis, long axis. That everything can be done on a screen itself. And one side, there will be a volunteer. So on that volunteer, wherever you'll be putting the probe, you'll be getting the picture. That's what happens in the ultrasound. So same thing will be happening here. But for that experience, you must be having laptop. On your mobile, you can't experience it nicely. So this is our plan in this session right now. Okay, so let us start. Let us start with the 3D anatomy first. Okay, so most of you understand this. Okay, I'll be asking question, huh? So you have to answer. So what is this? What is coming there? It is deep fascia. Deep fascia. And here, thoracolumbar fascia. So thoracolumbar fascia has how many layers? 3 layers. This is the posterior layer. There is a middle layer. Middle layer and posterior layer. What are the muscles in between? Erector spinae group of muscles. At the lumbar area, what are the erector spinae group of muscles? Most medially multifidus, then longissimus, and then iliocostalis. So the 2 layers of the thoracolumbar fascia is making the 2 boundary, posterior layer and the middle layer. But if you are going superficially, then the thoracolumbar fascia basically splits and it becomes thoracolumbar fascia and deep fascia. So this was the deep fascia. So this is the deep fascia. So if I am removing this deep fascia, the muscle, what is this muscle? Who can tell? This muscle? Latissimus dorsi, very good. So this is latissimus dorsi. So the lumbar area, if you are close to midline, we will not be able to see the latissimus dorsi muscle. But if you are going little laterally, particularly the upper and the lateral part, we will be getting the latissimus dorsi muscles. Here the latissimus dorsi is very thin like strap muscles. If you are going up, then the latissimus dorsi muscle is becoming thicker. So now I am removing the latissimus dorsi muscle. Let me remove it. So now this is your thoracolumbar fascia. Sorry. This is your thoracolumbar fascia. Let me remove that also. Then we are getting here in the lumbar area, we are getting the erector spinae group of muscles. Sorry. So, what is this muscle? Medial multifidus was multifidus is deep. So this is longissimus. Okay? So I am removing the longissimus. Now the multifidus is exposed. So multifidus is most medial, but little deeper. Longissimus is also medial, but it is superficial. And multifidus lies over the lamina. In between the 2 lamina, multifidus muscle is there. But longissimus, it starts from the facet joint complex and over the multifidus. And lateral to the longissimus, over the transverse process, what is that muscle? This muscle? Iliocostalis. This is iliocostalis. So let me remove this iliocostalis. Let me remove the multifidus. Then what comes? Then all the bones are exposed. So the lamina, transverse process. So lamina, transverse process. Here we can get 2 very thin muscles. What is this and what is this? Intertransverse lateralis and medialis. So intertransverse lateralis muscle. If I am removing that, then we are getting a fascia. What is that fascia? Intertransverse ligament. Okay. So in between the 2 transverse process, intertransverse lateralis muscle. After that, there is intertransverse fascia or ligament, whatever you tell. And then if you are removing that, then comes the psoas muscle. And in between, there are neurovascular bundle. And this altogether called as, known as ITC, intertransverse tissue complex. Not Indian Tobacco Company. ITC means here, intertransverse tissue complex. So what are the components of the intertransverse tissue complex? Most superficially is your intertransverse lateralis muscle. After that, intertransverse fascia, and then the neurovascular bundle, and then psoas muscle starts. And within the psoas muscle, we are having the ventral rami of the lumbar plexus. So the lumbar nerve roots, if you are putting the nerve roots, let me put the nerve roots here. Oh, sorry, these are vein. Nerves are here. So nerves which will be getting divided into the ventral rami, dorsal rami. Dorsal rami comes where? You see here, let me increase it further. Let me enlarge it further. You see, nerve root. The nerve root is divided into dorsal rami and ventral rami. So ventral rami branches goes, again further divides, it goes between the QL and the psoas, and some goes within the psoas. And within the psoas, they form the lumbar plexus. So if you wish to do the lumbar plexus block, you have to go within the psoas muscle. So in fact, the psoas block, or if you are calling the psoas, the trigger point injection, and the lumbar plexus block, almost all are basically similar. So the nerve root, ventral rami, dorsal rami. Ventral rami branches are going through the QL and the psoas, and also through the psoas. And dorsal rami branch, you see what happens here? Dorsal rami branch. How many dorsal rami branches are there? 3. Medial, intermediate, and lateral. Medial has the maximum supply. What are the supply of this medial branch of the dorsal rami? One is muscular, which is supplying the multifidus. And then a lot of sensory supply is there. It is supplying the facet joint above and below. It is supplying the ligaments in between the two spinous process, this interspinous ligament. So suppose somebody is having the interspinous ligament sprain. One of the very important interventions what you can do is medial branch block. So medial branch block is not just for the facet joint. If somebody is having the intractable or recurrent pain coming from the interspinous ligament, then also you can perform the medial branch block. Then comes, so it has a very important sensory supply. See, this branches is going to supply to go in between the two spinous process. And branches are going to the above facet joint, below facet joint, and muscular branch. Intermediate branch is very tiny, and it supplies a muscle. What is that muscle? What is the next muscle after the multifidus muscle just now we have discussed? Longissimus. So intermediate branch supplies longissimus. And then comes lateral branch. Lateral branch supplies iliocostalis. But also lateral branch also have some sensory supply, which supplies the back, particularly the posterolateral part of the back is supplied by the lateral branch of the dorsal rami. So for coming to the interventions, we are having very important interventions here. And they are almost similar, but the placement of the needles are almost same. So one branch you all know is your medial branch block. And where the needle should be placed? Needle should be placed at this junction. Means the medial branch, transverse process, this is superior articular process. At this group, you have to place the needle for the medial branch. Right? But anesthesiologists are more accustomed with the erector spiny block. So for the erector spiny block, where the needle should be placed? Erector spiny blocks which nerves? All the dorsal rami branch. Because here our needle is placed over the transverse process. And all the dorsal rami branches, they are resting over the transverse process. So the erector spiny block means you are placing needle anywhere here over the transverse process, and you are going to block these three. So this is known as the erector spiny block. But there is another, particularly that is important for the pain physicians. Almost similar, but name is different. That is known as dorsal ramus block. So dorsal ramus block is what? Almost same as the erector spiny block. Means there also we are putting the needle. So for the erector spiny block, you can put the needle anywhere. For the medial branch block, you have to come most medial to block this nerve. And for the dorsal rami branch, your needle should be in between, in the middle of the transverse process, so that you are blocking all the 3 dorsal rami branches. So they are the 3 very important part of the blocking the dorsal rami branches, either selectively medial branch or the other branch. So here one very important aspect of the ultrasound is, I'm sure that many of you are doing the facet joint denervation, medial branch block. I'm sure many of you are doing it. So how the needle should be placed? The needle should be placed at this junction. And how to know that you are targeting the right nerve? You have to do a sensory stimulation and the motor stimulation. What are we going to expect from the motor stimulations? Multifidus contraction, isn't it? But you see, the intermediate branch is very close. Lateral branch is also close. So if you are putting the needle here, and if there is a little bit of anatomical variation, or if your needle is just little bit of few millimeter lateral, then you can stimulate, because you are not seeing the nerves. When you are doing it under the C-arm guidance, your needle is placed based on the, X-ray. and you are not seeing any of these muscles. With the ultrasound, we can see all these three muscles, multifidus, longissimus, iliocostalis. And though you cannot see the individual dorsal rami branches, but you can see the contraction of the muscles. Means, suppose your needle is placed over very close to the medial branch, your needle is placed close to the intermediate branch. And you are doing an RF ablation. Are you going to denervate the facet joint? Yes or no? No. Because the conventional RF, only few millimeter is the diameter. So you are going to, your patient is landing up with a failure because you are ablating intermediate branch. Intermediate branch is not your target. So it is very common that actually your longissimus is contracting and you are thinking it is multifidus. Because these two muscles are very close. And just now I have shown you that the multifidus is just little deeper than the longissimus muscle. So the multifidus contraction and the longissimus contraction, just looking superficially with your movement over the skin and the movement of the needle, you cannot differentiate between these two. You cannot appreciate which one is basically contracting. So, and same thing is true for the lateral branches as well. If you are stimulating the lateral branch also have some sensory supply. So you might be getting paresthesia also. Patient will be telling that, okay, I am having the paresthesia in the back, and there is a contraction of the iliocostalis. And you might be thinking that multifidus is contracting and ending up with a failure. So here, the ultrasound has a very important role that if you are able to see that which muscle is contracting, then accordingly you can reposition your needle. You can go a little more medially to target the medial branch rather than stimulating the intermediate or the lateral branch. Right? Okay, so let us go a little deeper. So thoracolumbar fascia, we have discussed. Thoracolumbar fascia is splitting. If you are going above, then it is splitting between the posterior layer of the thoracolumbar fascia, deep fascia. In between these two, there is muscle is known as, what is between this thoracolumbar fascia and deep fascia? No. Latissimus dorsi. Most superficial. After the deep fascia is, just recapitulate on this side. So this is your latissimus dorsi muscle. It is covered by which fascias? Deep fascia superficially, then latissimus dorsi muscle, then the posterior layer of the thoracolumbar fascia. So now posterior layer of the thoracolumbar fascia here. So posterior layer of the thoracolumbar fascia, that is, and middle layer of the thoracolumbar fascia, that is enclosing erector spinae group of muscles. Now this is your middle layer of thoracolumbar fascia, middle layer. And after the middle layer of thoracolumbar fascia, we are having quadratus muscle. And then comes the anterior layer. So in between the middle and the anterior layer, we are having the QL muscle. So if you wish to do a QL block, there are different varieties of the QL block. You can do the QL block between the, if you are going anterior to the anterior layer of thoracolumbar fascia. So anterior layer of the thoracolumbar fascia is between QL and psoas. There is another QL block that is between the erector spinae and the QL at this layer. That is just superficial to the middle layer of thoracolumbar fascia. Okay? So we will be able to see all those things, and here is the intertransverse tissue complex, ITC, and anterior to that is your psoas and a lumbar plexus block, what I told you. Right? So now those who are having the laptop, they can experience the simulator, they can open it. But before that, as I told you, so there will be one Kahoot. Okay, so all of you open your mobile and open the kahoot.it. In your mobile browser, any of the browser, open kahoot.it. So unless you are playing Kahoot, you are not going to get the, the free version of this app. You have to play Kahoot, mandatory. So this is the game pin. Put in your mobile the game pin. Put your real name. Because in your real name, we'll be sending you the login credentials later on. And right now, who are carrying the laptop, they can experience it. All these names will be automatically saved to us, and we'll be sending you the login credentials here. Kahoot.it, and then it will be asking your game pin. So game pin you can see there, and then put your real name. Not Kahoot.com, Kahoot.it. It is written there, Kahoot.it. 61. Nickname is your real name, madam. A. Goswami. Shall I start? Anybody is still waiting? Shall I start? Shall I start? Okay. Wait, okay. Okay. Bihu ma'am is asking to wait. I'm waiting. Okay, so I'm starting. If anybody else is still struggling to join, I can wait. Kahoot.it, on your mobile, Kahoot.it, on your mobile browser. Dr. Gopi, on your mobile, open a browser and write Kahoot.it. And then it will be asking for the game pin. You put this game pin, what is there, displayed. And then put your real name. Kahoot.it, Kahoot.it. Real name, we need real name. Anybody named Bond? Because unless you are putting your real name, we can't send you the login credentials. RG also we cannot. Okay, then one thing you can do, you can send a message to me sending that I am the Bond. Okay, let me start. Just whatever I have discussed just now, the 3D anatomy. Which muscle between the anterior and the middle layer of thoracolumbar fossa? Psoas, QL, iliocostalis, multifidus. So on your mobile, the color code is there, put on that color code. So if the right answer is psoas, put on the red mark. If the right answer is blue, put on the red. Okay, 24 right answer and then wrong. Okay, don't worry. Whether you have scored any point or not, everybody will be getting this login credentials. What is the full form of ITC? I told you it is not Indian Tobacco Company. Anything else other than that? Okay, again maximum right answer. Next, all are the muscles of the rectus spinae group of muscles in the lumbar area, except iliocostalis, QL, longissimus, multifidus. One is not a erector spinae muscle. Oh my God, lot of wrong answers. Last question. Name the muscle of the anterior to the transverse process. Anterior to the transverse process. Iliocostalis, longissimus, psoas, intertransverse lateralis. Anterior to the transverse process. What is the name of the muscle? Okay, so let me see. Guru Murthy. Then Sneha. Second. Let me see who is the first. Senthil Prakash. Okay, congratulations, Senthil. Anyway, so whoever has participated, we will be sending you the login credentials. It will be activated from 1st of April. But right now, those who are in the laptop, now open it and we will be starting the USG simulator now. So those who are having laptop, so first you type, I am typing it here, you also type Daradia SimLearn, DARADIA SIMLEARN.com. So, DaradiaSimLearn.com. Pardon? No, Wi-Fi is there, but I don't remember the password. You put your hotspot. I don't remember. You have to then ask and you just put your hotspot on and it is there, but Wi-Fi is there, but only for the laptop. Desktop also same.
Hello.
Laptop or desktop?
The password is access with a capital A @1234.
Okay, then you have to go, after you are getting this page, so this is DaradiaSimLearn.com. After you are accessing here, then you log in. Login credential is a@b.com. a@b.com and password is 12345. I have already logged in, so basically it didn't ask for. a@b, all small, a@b.com. a@b.com. I don't have Wi-Fi password, I told you. But those who are trying to open it through the mobile, you will not be getting the actual experience. I told you it is a USG simulator. So you have to have a mouse. Your mouse is acting as a probe. If you don't have a mouse, you can't use it as a probe. So you must be having a mouse. It can be laptop, it can be desktop. Even if it is laptop, you have to attach a mouse. Otherwise, this mouse will be acting as a so the cursor will become, if you are putting it over the hand, then you will not be having the experience that you are holding the probe. Your mouse will be converted into a probe. Okay, all of you have accessed? Login ID is your a@b.com. All small. a@b.com. And password
Hello?
is 12345.
Yes. The Wi-Fi password is access capital A@123. And the Wi-Fi is capital B CC dash Wi-Fi.
Okay, can you come and put it here? I'm just... আমি এখানে একটা ওয়ার্ড ফাইল খুলে টাইপ করে দিচ্ছি। না না, এখানকার ওয়াইফাই পাসওয়ার্ডটাও দিয়ে দিই। So this is your Wi-Fi, capital B.
Capital B.
This is the Wi-Fi. Okay, connect to the Wi-Fi. And your login ID is a@b.com. And password is 12345. This is, and the site name is your Daradia Simlan. Demo, okay, sorry. Right? Okay, so this is the password. And site where you have to log in is your www.daradiasimlearn.com. So this is the site you have to go, and it will be asking for the login ID, that is a@b. And all of you have logged in. Shall I proceed? What? No, have you logged into this? Now the lumbar spine module is active. So I clicked on the lumbar spine module and I came this page. Okay? So now, you see, this is my mouse, the cursor. As soon as I am moving it over the back, so this is the model, and if I am moving it, and you see this is now long axis, and my cursor is oriented vertically. So cursor is now converted into a transducer, and it is in the vertical. If I wish to do it in the short axis, I can change it to the short axis, then cursor will be oriented in the short axis. So this is your long axis. I'm now long axis, and I'm putting it in the long axis. Now if I'm moving the cursor from lateral to medial, so I'll be getting all the layers, layer by layer. If you are going outside the grid, it will not come. So inside the grid also only you can see. So I'll be just going through and I'll be telling you all the details. But here also another very important feature is there, that as soon as in some areas which we call as the reference point, means from where the anatomy is changed, so there are all the labels are there. So On the right hand side corner, you see there is a label button. That label button will be activated only when you are coming in the reference point. So this is a reference point. If I'm freezing it here, so just put a left click, it will be freezed. Like in the ultrasound machine, there is a freeze button. Here your freeze button is the left click. So as soon as you are making a left click, so it will be freezed. And then you can unfreeze it. When it is freezed, then there will be a annotate button. And the other button, gain also you can increase it. You see, I can increase the gain. I can decrease the gain. There is depth button also, but it is still not activated. And I am coming to the annotate button. But before that, let me just move the, the transducer in the long axis from lateral to medial. If I'm going, we are getting all those things. So let me just go a little bit about the annotation. So this is now, I have put the left click and image is now freezed. So there is an annotate button. This is particularly useful when you are teaching others. So you need to annotate and you need to label it. So that feature is there. So now let us again, just quickly recapitulate what we have learned in the 3D anatomy. So what is this layer? This layer, skin. Skin looks hyperechoic. After that, there is a hypoechoic area with some connective tissue septa. What is this layer? It is subcutaneous fat. And then there is a white hyperechoic layer. What is that? Remember, my probe was here. Where? Upper and the outer part of this grid. What is the fascia there? Deep fascia, very good. So thoracolumbar fascia is not there. Thoracolumbar fascia, if you are coming, not superficial. Thoracolumbar fascia is there. After that, there is a muscle, very thin layer of muscle, this muscle. What is that muscle? Latissimus dorsi muscle. After that, there is a hyperechoic line, this line. What is that? Posterior layer of thoracolumbar fascia. So all this will be labeled there. If you are putting the label button, you can just put the label button and you can see what are all the layers. But you can also, during the teaching, you can just go through this and you can annotate it. And then, see, here the transverse process is not seen. Okay? So, my cursor was here. My cursor or transducer, whatever you say. Then what will be this muscle? No. Iliocostalis is the right answer. So, this is the posterior layer of the thoracolumbar fascia. This is the middle layer of thoracolumbar fascia. So what is the muscle between the posterior and the middle layer of thoracolumbar fascia? We have discussed during the anatomy class, anatomy part. It is the most medially and deeper is multifidus, then your longissimus, then your iliocostalis. So when we can't see the transverse process, or when you can see the part of the transverse process, the muscle, erectospinal muscle is your iliocostalis. Once we start seeing the articular pillars, then the erectospinal muscle will be your longissimus. And when we start seeing the lamina, then the muscle what you will be seeing is your, remember this rule. I will be showing you in the short axis as well. So this muscle is your iliocostalis. Then the posterior layer of thoracolumbar fascia. And then there is a muscle there. What is this muscle? Remember, I am in the lateral part. This is QL. So this is middle, this is QL. Here psoas is not there. That means if you are moving laterally, in the lateral part of the grid, you are not going to see the psoas muscle. Clear? Okay, so let me clear the drawings and let me unfreeze. And now, okay, so it is unfreezed now. Now you see, I was initially here. Now my cursor was in the lateral part of the grid. So I was able to see the latissimus dorsi, posterior, the deep fascia, the posterior thoracolumbar fascia, QL, then is iliocostalis and QL. Now see, I am going more medially. So what is happening? Let me freeze it here and let me annotate here. So here again, skin, subcutaneous tissue, deep fascia, latissimus dorsi, posterior layer of thoracolumbar fascia, then iliocostalis. But we have started seeing the transverse process now. And what is this? One transverse process you can see, other transverse I can't see. If I'm coming down, I'll be seeing the two transverse processes or three transverse processes sometimes. So what is this? ITC. The muscle, thin layer of muscle and the intertransverse ligament or intertransverse fascia. Intertransverse, thin layer of muscle is your intertransverse lateralis muscle. And after that, the psoas, and within the psoas, this is a neurovascular bundle, the ventral rami branches of the lumbar plexus. Clear? So now let me clear this also, and let me unfreeze. And so I'm there in the long axis. So I'm going more medially. Now the transverse process is very prominent. So let me freeze it again and let me annotate it here. So this is the transverse process. This is the transverse process. Most of the times when we take the class, we always tell that this is the home page. So you can consider it as a home page or not, whatever might be. And then this part is your intertransverse tissue complex. Here you see the deep fascia is not seen. Now it is, everything is here little bit of very thin layer of latissimus dorsi you can see. This is your posterior layer of thoracolumbar fascia. And then your erectospinal muscle. Here the erectospinal muscle will be what? Same, iliocostalis. Till you see the transverse process, it is iliocostalis. When you come closer to the articular pillar, then only it will be longissimus. So now all the layers are same. Now let me clear it again. Now let me freeze it. So not this one. Okay, let me freeze it here. We cannot see the latissimus dorsi muscle now because we are more medial. What is this layer? Posterior layer of thoracolumbar fascia. After this, what is this muscle? No. Multifidus. Longissimus is very above thin muscle is your longissimus. And muscle from this there is your multifidus. What I told? When your probe will be over the lamina, these are lamina. Laminar view, or also called the horse head view. So once you are in the lamina, the deeper muscle is your multifidus and superficial muscle is your longissimus. Okay, now let me see who can tell these things. What is this hyperechoic line? In between the two lamina, hyperechoic line. Ligamentum flavum. Okay, this is your, I am erasing it. This is your ligamentum flavum. This is known as posterior complex. Posterior complex, most superficial is your ligamentum flavum, and then there will be a gap. This hypoechoic area is your intercostal epidural space, and then this is your posterior dura. So this whole thing is known as posterior complex. Okay? And after that, the spinous process. This is posterior complex, and little bit of anterior complex is also seen here. If you're increasing the depth, then you'll be seeing the posterior complex, anterior complex as well. In the anterior complex, we are having the anterior dura and the posterior longitudinal ligament. Right? Now, let me see a little bit of in the short axis, because time is. So now I'm putting my, the cursor in the short axis. And the orientation is changed. Okay? So I'm coming from here. Sorry. Let me freeze it here. So, what is this? Spinous process? No. It is in between the two spinous processes. Why? Because I can see here ultrasound beam is going on. So let me annotate. So this is again your skin, then is your black is your what? Subcutaneous fat, then posterior layer of thoracolumbar fascia. Here you are not seeing the deep fascia or latissimus dorsi muscle. And then your Sometimes you'll be seeing the spinous process, sometimes you'll not be seeing. It will be looking almost similar. Only thing is whether you are seeing the anterior complex, posterior complex or not. If you are seeing the anterior complex, posterior complex, that means you are in between the two spinous process. And when you are not seeing anything, I'll be showing you, moving the cursor, and I'll be showing you that part as well. Here, what is this? Everybody should say lamina. And this is your facet joint. This gap is facet joint. So if you wish to do a facet joint intra-articular injection, your needle should come like this. Facet joint intra-articular. So you have to tell me this, what is this muscle and what is this muscle? What is this? Multifidus. And what is this? Longissimus. Very good. And what is this? This is your transverse process. This is your transverse process. So what is this muscle? Above the transverse process? Psoas is below transverse process. This is psoas. This is psoas. But not seen because of the transverse process. So this muscle is your iliocostalis. Over the transverse process, iliocostalis. Anterior to the transverse process is your psoas. Okay, let me clear and let me go to the another part. Okay, so let me go into the short axis. So I am in the short axis. So now I am over the, now I am over the transverse process, right? Why? So not spinous process, sorry, because I can't see anything there. It is not getting freezed. You see, this was the image when I was showing you earlier, but this image is different. Here I am in the midline, but here because I am over the transverse process, I am over the spinous process. So this is over the spinous process. Because I can't see anything and I can see the hyperechoic line, that is your spinous process. And the other muscles and ligaments are similar. So in this hot axis, so very important intervention what you can do is your interarticular fascia joint and the dorsal rami branches. Okay, now it is getting freezed. And so if you wish to, this is your multifidus, this is your longissimus, this is your iliocostalis, up to here, this is your psoas. So if you wish to do the fascia joint block, your needle should come like this. If you wish to do the medial branch block, your needle should come like this. If you wish to do the dorsal ramus block or the erector spinae block, your needle should come like this. The three important interventions for the dorsal rami branches. Okay, so let me stop here. Some more features are coming. And I'll be asking Nandini. She and her team basically helping us to develop this software. So majority 80% job is done. Still 20% is still left. And she'll be showing you some other features. She'll be showing some other features. What is coming right now? We'll be sending you all the login ID and the passwords, individual login ID and password on your email ID and these things. You can, whatever I have shown you, you can access and you can do all those things. But some more features are coming, what Nandini will be showing you, which is there in our demo version, but not the actual app.
Good morning, everybody. Thank you, Dr. Das, for explaining. We've already figured out, while I was sitting down here, I figured out that we still need one more feature. That whenever we are freezing somewhere, you need to know on the picture what point it is. So because today is the first day I am attending his lecture, I am understanding what is happening. So that is a feature that I have just now discovered that we have to introduce. But I'll just run you through the other features once you log in, because everybody will log in as a student. Of course, you can see the modules you have worked on. Like every other user, you'll be able to see your profile. You'll be able to see if you query. In the last, here we had a question answer section at the back below where you can ask queries and you can see your own queries that will come up. We also we are planning to put in conditions. So if there is a, whatever Dr. Das is explaining, the important notes, if we click on this, those important notes will come as a pop-up here. So all those you can see when we are in so different people will have different notes that they're saving. When you come into your profile, you'll be able to have a fair idea of what your class is about, what are the annotations that you are doing, what are the queries, because tomorrow you might want to use this and make a paper. So your queries, this is where, as a student, as a user, your details will be saved in. So these are all the, and I will not show you home because we are still not on a cyber secure place. So it's not really coming back to the home. Once you go back and if you write HTTP colon and / and don't add the S, then we can show you a little bit more of the features. Otherwise, I am sitting down here. Anybody can come over and see it on my laptop, and then I can show it to you how you can access it in yours.
Okay, what you can do is, to have the experience outside at Daradia stall, we are putting this laptop there, and you can experience it, and you can just see how you are, you can go through that. It's exactly the same way, because what they have done, we have given the multiple, the pictures, all the pictures was basically broken down with an coding, all the pictures was 7,500 already, the images already has been loaded, some more images are coming. Even the pathological images also will be coming, that will also be loaded. So the process is going on, 80% job is done, still 20% is there, but still whatever has been done, you can experience it. The problem, unable to log in because of the cyber security, but it is there in our laptop or Nandini's laptop. You can come to Daradia stall and you can just see how you are going to use it. And as I told you, from the 1st April, everything will be there. So whoever is in this hall will be sending you all the login ID and the credentials, and you can start using it from the 1st April.
Yeah, because we are migrating it into AWS. Now it's on a common server, our own, while we were not working. We are just under migration today. Once it's on AWS properly, you will have all cybersecurity and everything will be fine. But we're still in migration. There were 7,500 pictures and there were 7,500 labels. So some of the labels were, they were not matching the exact ones. So we're still under demonstration. I can show it to you on my laptop. And then by very soon it will start getting up. We also want to put in all the joints. So we've just taken footage of the lumbar, but all the other musculoskeletal joints will come in. There should be around 35 joints that we want to introduce into this place. Thank you everybody.
So all the other joints are. So all the other joints are also coming one by one. So we are starting with the lumbar module, which will be active from the first. Full version will be active. Right now it is active, but full version will be active from the 1st of April. And you can experience it. But all others are coming. And in fact, now we are using this SimLearn app for our online classes as well. So at home, you don't need to sit in front of a ultrasound machine. You just need to sit in front of a desktop or a laptop, and you can attend the class, and you yourself, whatever will be teaching, you yourself use your cursor as a probe, and you can practice it at home without having a laptop, without having an ultrasound machine, without having your volunteer. So thank you very much, and the credit goes to her, the Nandini, so big clap for her. So, and you can experience it outside at Daradia stall. We are already getting late, so I'll be asking the other sessions to start. Thank you very much.
Here, and I think it's very good for us to network, and I know Dr. Gautam for the last almost 8 years. He's been coming to Malaysia. We invite him for run our cadaveric courses, Spain, and then I think our networking will only grow bigger. I think we'll see more of networking between Malaysia and India. We are actually running I just signed an MOU with him, so we're going to send fellows to train and vice versa. So hopefully we'll begin a chapter to do all this together. You're doing great work, and you just as a token from Malaysia, we just I'm going to give him a souvenir from Malaysia. you can. Tell them this is just like how India is famous is sari. Malaysia is something called batik. Batik is a hand printed shirt, very custom made, handmade. It's like a gift of honor.